Going to be sharing an amazing topic today. The topic today is how tapeworm cysts cause MS symptoms, not just MS symptoms, but they also cause symptoms found in virtually any type of neurological disease. If we haven't met, my name is Pam Bartha. I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I am really passionate about finding the root cause of chronic disease. Over 30 years ago, actually 35 years ago, I was diagnosed with multiple sclerosis, and I went from being a really healthy person to being somebody diagnosed with this incurable disease. And I was shocked, and I couldn't understand how that's possible, how you could go from being super healthy to being, having this incurable disease where you're going to end up in a wheelchair, totally disabled in time. Well, that really started my journey to healing, and I have been able to live MS-free now for over 35 years, and we've learned that MS and other chronic diseases, all chronic diseases, they have, the biggest cause of them would be infections in the body, parasitic infections. And so as we treat these infections, as we treat the parasites, we can recover. We can have a lot more recovery than we thought possible. So the reason that this topic is so incredibly important is because this is groundbreaking research. So last week I shared Dr. Alan McDonald's finding. I shared his study, and his study is called Novel Brain Compartment Tapeworm Larva - Possible Environmental Initiators of Demyelination in Multiple Sclerosis. So Dr. Alan McDonald is a pathologist in the United States, and he discovered the immature form of tapeworm in the central nervous system of every MS patient that he tested, subject, 10 out of 10. And not just 1% or 10%, but 100% of the subjects he looked at, he was able to find the immature form of the tapeworm. So what could be worse than having a big tapeworm in our intestines that causes a lot of stomach pain and stomach aches, and maybe we're having a hard time putting weight on, maybe we have diarrhea or constipation, but actually it's the immature form. It's their little babies that get into our organs and into our eyes and into our central nervous system. They cause a lot more damage. When they're in the central nervous system, they can cause all of the symptoms that you would find in any neurological disease. So they actually mimic different types of neurological diseases. So then you're like, do they mimic them or are they causing them? That's the big question, right? And before I continue, I just want to share that I'm not saying that the tapeworm larvae are the only parasites we need to treat in MS, because we do know that with multiple sclerosis and other chronic diseases like ALS, PLS, Parkinson's, all these diseases, we're in a state of dysbiosis. We have multiple parasites. But yes, if we, let's say, have Lyme disease, right? We have the Borrelia, the bacteria that cause Lyme disease. Well, if you have the filarial worms, or you have the tapeworm larva, or even developing tapeworms in your central nervous system, those bigger worms are going to cause so much more damage in your central nervous system than a bacteria would. So we have to consider the size and the number. And again, as I share with you, I'm going to share with you like how it's possible that these immature tapeworm larvae cysts can cause so much damage in the central nervous system and cause the symptoms of MS. So they're one of the parasites that cause multiple sclerosis. Very important, before I forget, I wanted to mention that I'm going to talk about the life cycle so you understand how the tapeworms, like sometimes they're in the worm form, sometimes they're in the larval form, how they get into different places, how we treat them. So I'll be talking about all of that. But very important to note that when they're looking at imaging, so MRI, or they're looking at CT scans, especially MRI, I would say, they notice that these cysts appear as lesions on MRIs. So when they're looking for MS, they're looking for lesions. When we have cystic tapeworm larvae in our central nervous system and our brain and the areas around the areas where the spinal fluid is around, those would look like lesions on MRIs. And again, I'm not saying that the tapeworm larva is the only parasite we have to address, but it looks like it's a pretty significant one. And I will go into the reasons why. So when these babies, these immature larvae that form cysts, when they get into the central nervous system, it's called neurocysticercosis, and that is well established in science, well established with the CDC. It is an infection caused by the tapeworm larva, cysts, in the central nervous system. So it's not that we have to convince the CDC, we don't have to convince doctors. It's very clearly defined, and there's case studies, there's testing, there's treatments, recommendations, etc., that especially from the CDC. So they know that when the tapeworm, so the larva means the immature tapeworm, so when the tapeworm larva, they get into the central nervous system and they form cysts, I'm going to call that neurocysticercosis, NCC, just because it's easier to say. So when when we have this condition NCC, it's just known with the CDC and in science and in medicine that this condition causes a lot of disability and it can cause death. It's really, really serious, and it is a really common infection that they find in underdeveloped countries, but it's really overlooked, and it is present in developed countries too. So tapeworm larvae, cysts, they're basically sacs, like a bladder sac. And in that bladder, there will be a number of immature, like little tiny hatched eggs of tapeworm, developing larvae, so immature forms. And Dr. Alan MacDonald found in some of the sacs, like 2 larvae. In other sacs, there could have been up to 8 larvae. So the sacs can be different sizes, and there can be different amounts of them. And I've even heard or read that when, let's say if the sac ruptures, if the sac ruptures and the immature larvae escape, they can set up new cysts in different areas. So it almost sounds like cancer. It's pretty crazy. So the tapeworm larva cysts are sacs that contain the immature larval stage of the tapeworm. And NCC, which is the neurocysticercosis, it's regarded as a great imitator because the symptoms of this condition, they mimic pretty much all neurological diseases. And really, the disease that we would get from this and the symptoms of the NCC really depends on how many cysts we have, how big the cysts are, and the location of the cysts, and finally, how intensely our immune system reacts to these cysts. So all of that is really determines what kind of symptoms we have and possibly what kind of neurological disease we are diagnosed with. So the NCC, it may be in the brain tissue, but it could also be in the spaces that where the spinal fluid would be around the brain. It is the most common central nervous system parasitic infection in humans, and it is the most common cause of epilepsy. Again, it is a neglected disease, but it is preventable. So how do people get this NCC, this neurocysticercosis? Number one, we become infected by tapeworm eggs. So we can ingest, so a lot of us think, well, you know, like I'm a vegan, I'm a vegetarian, I don't eat pork, so I am not going to be exposed to the tapeworm. That's not true because the tapeworm eggs can be present on vegetables and on fruit, in contaminated water. If you eat in restaurants, let me backtrack. We can self-infect ourselves. So let's say we have a tapeworm inside of us. We go to the bathroom and we don't wash our hands well, and we have eggs on our fingers. We can actually self-infect ourselves. If there's other members in our family that have tapeworms and they don't use proper hygiene when they're preparing food, they can cross-infect other family members, including ourselves. we can get these tapeworm eggs from contaminated water, but most of us are not drinking contaminated water. Although sometimes our municipally treated water, sometimes the chlorinator doesn't work. It will not work for a day or so, and then we can be drinking raw water. So again, it can be contaminated on fruits and vegetables, raw vegetables and raw fruit, also contaminated water. We can infect ourselves if we do have a tapeworm inside of us. They can lay many eggs, and so we can reinfect ourselves with more tapeworm eggs, and also from other people. So whether we're in a restaurant and maybe there's somebody who they've been traveling, or maybe they haven't traveled, maybe they're from another country, but maybe they just have tapeworms and they're not washing their hands well when they're preparing our food. So there's many different ways that we can be introduced to tapeworms. So that's how we can ingest the tapeworm eggs. So the second way that we can have this disease, and I'll talk about how the eggs, turn into this neurological disease. But first of all, we have to ingest the eggs, or we have to ingest the larval cysts. And the larval cysts are ingested very often if we're eating undercooked meat. So there's information out there, and I question everything. So they talk about the pork tapeworm all the time, and they're like, no, there's in what I have looked, and honestly, I haven't spent months or years researching this, but what I have seen is they're saying, oh no, it's just the pork tapeworm that causes the cysts and moves into different organs, and it's not the beef tapeworm, not the dog tapeworm, not the fish tapeworm. But when you look at those other life cycles of the different types of tapeworms, they all can produce these larval cysts and move into muscle tissue. So I'm a little skeptical about that. And then especially Dr. Alan McDonald, he found that that the cysts in the spinal fluid of MS patients, that it was a smaller species, like it was a type of tapeworm that was smaller than the pork tapeworm. It was much smaller. So I believe that there are probably different species, different types of tapeworms that can cause this, not just the pork. That's my own personal opinion from the research that I've done. Anyhow, so the second way that we can end up with this condition eventually is where we are ingesting the immature form. So like if we're eating meat and the larval cyst likes to move into muscle tissue of for example, pork for sure. But again, this is just another way. Maybe it could be beef too, etc. But when we ingest that larval cyst, then it can also turn into a tapeworm inside of us. And it likes to live in the small intestine. So it likes to move into the small intestine, and it takes usually a while before we start to show symptoms after we've been infected, but it can grow up to at least 8 meters in length, these tapeworms, depending on the species, right? Depending on the type of tapeworm we have. And they can survive in us for 10 to 20 years, which is awful. So it's very important to know that, if you have a tapeworm in your intestine, in your small intestine, and you can have multiple tapeworms, not just one, just know that you can keep reinfecting yourself if you are passing the eggs and you're not using proper hygiene. And I've read somewhere that the tapeworms can actually release over 1 million eggs at a time. So tapeworm, the pork tapeworm infection, it is widespread in countries like Mexico, Central America, South America, Africa, South Asia, India, the Philippines, and Southern Europe. But keep in mind that in our grocery stores, we have a lot of produce from those countries, and they might use fertilizers that maybe have tapeworm larvae or tapeworm eggs on them. And if that's the case, then we become infected. So we do have tapeworm in developed countries for sure. We can get infected from just, like even from our own pets, I'm sure. So the tapeworm eggs from the environment are swallowed and they hatch in the small intestine. So the eggs will hatch and they will then be called oncospheres. And interesting, oncology, cancer, I'm digging more into that. There's a lot of ties with, and I'm not saying all cancer, but there's a lot of interesting links between cancer and this too. So these oncospheres are hatched eggs, and they are the larva. They're the immature form, and they develop into these larval cysts. And again, cyst means it's like developing a sac around it. It's a protective membrane so that our immune system is not going to really deal with it properly. It's going to be harder to treat with medication. So it protects the larva. Or the eggs can hatch and become oncospheres, and they can move into various tissues. So they can either move into the intestine, so that once the eggs hatch, become oncospheres, they can move into our small intestine and develop into an adult tapeworm, or they can turn into larval cysts and move into different organs. I've seen things like liver, heart, gallbladder, pancreas, eyes, and also lungs, but also the central nervous system. They have a great affinity for the central nervous system. And tapeworm eggs can be ingested again from fruit and vegetables, undercooked meat, contaminated water, and also through self-infection, or maybe others are sharing their tapeworm eggs with us. So different symptoms. Again, the symptoms really depend on where these larval cysts live in the brain, in the spinal fluid, or in the whatever part of the central nervous system they're living in, and the numbers of cysts that we have, but also the size of the cysts. So different symptoms can include headaches, blindness, dementia, meningitis, seizures, depression, cognitive dysfunction, dizziness, poor balance, poor coordination, difficulty walking and falling often, nerve pain in the spine or the limbs, muscle weakness, muscle twitches or spasms, muscle paralysis, changes in thinking or behaviors, confusion, loss of consciousness for even a moment, hallucinations, tinnitus, hearing loss, loss of taste or smell, and then also involuntary, rapid, repetitive movements of our eyes, facial nerve palsy, trigeminal neuralgia, and a pain that radiates from the back and the hip into the legs and through the spine. So the diagnosis of this neurocysticercosis would be definitely looking at our health history, looking at our symptoms, looking at factors that could make us more, expose us more to tapeworms in our environment. They can do a stool test where they're looking for tapeworm eggs, and they're also looking for proglottids, which are segments of the tapeworm that carry the eggs. What we have found really helpful is to be energy tested. So when our certain healthcare professionals will have access to the commonly prescribed parasite drugs, and they are able to energy test to see if a specific parasite test or parasite drug tests well for their patient, and they're able to see, like, okay, if they're testing well for different parasite drugs which will treat tapeworms, they probably have a tapeworm, right? So that energy testing is really helpful. And then NCC diagnosis, again, that is with what they're doing is they're using an MRI or they're using a CT scan. I'm just going to grab a drink of water here. So MRI scans or CT scans and serological testing, so antibody testing. So that's the nice thing about this, is that we don't have to create tests. There's tests that are available, there's treatments that are available, and we just have to get doctors on board to start looking in this area. So keep in mind that serological test results could be negative, even if the patient has tapeworm cysts, and or lesions could be visual with imaging. Pardon me, I've just got a little cold from my grandkids. Grandkids are great. They pass lots of little colds around. So we may have an antibody test that shows up negative, but we still could have tapeworm lesions and cysts, and that would be visible with imaging. So that's one. So that's why they have two different ways of testing, through imaging and through looking for antibodies. Also, a patient might have larval cysts in the areas outside of the brain. So they not in the brain, but also in the areas where the spinal fluid lives. And so then the antibody test will be positive, but maybe it won't show up on the imaging. So that's why it's helpful to have both. So the location and the characteristics of the lesions on imaging, especially on the MRI, are essential for the best treatment, to figure out the best treatment options. And CT scans are superior to MRI imaging. They'll show these small calcifications, whereas MRIs would be more helpful in as opposed to a CT scan. They could be more sensitive and they might show edema. So sometimes if the sacs that have the larval cysts, if they rupture and they leak out a little bit, then there could be some swelling around it. So that will show up more with the MRI scans. And also, when looking at these larval cysts, like some of them will eventually die, and the MRI might be more helpful in showing that. There are two available antibody tests. One is called, it's just short for EIBT. I'm going to put all of this together on a blog post. We'll have it ready by Friday this week. So it'll be on the livediseasefree.com website, and I'll have a copy of this video, and I will have like my written notes. So you'll have links to the studies, you'll have the names of the testing, you'll have the names of the treatments. And I really encourage you to share this with anyone who will listen, like doctors, neurologists, like some of them won't listen, but please share this with anyone who will listen. I can't do this by myself. And if you guys want change to come, then you have to, when you're given this wisdom, you have to put it out. You have to get it out. And some doctors are going to pay attention and some won't. And it's like next. Some groups will share this with different MS groups, and it's not just MS, it's any neurological disease. Maybe you have terrible headaches. Maybe you don't even have MS. That could be caused by this. And I'm not saying everyone with a headache has tapeworms, but this is where it's like, okay, well, maybe I need to check. I've had migraines for years. Maybe I need to start to look and see, like, do I have symptoms of tapeworms? Have I been exposed to tapeworms? Do I test well for tapeworm medication, or could it be some other infection? But it is something, it is an infection, and it can be treated, and you don't have to live with these symptoms. But we have to get our healthcare system to recognize this, to test for it, and then if they can test for it, they will treat. So again, the two antibody tests would be the EITB, I'm not even going to, enzyme-linked immunoelectrotransfer blot, which doesn't mean anything to you, but EITB. And there's also an enzyme-linked immunoassay test. So those are the two available tests. And the CDC has information about this on their website. I'll be linking to their website. And there is one commercial lab that offers the EITB testing. All right. And then treatment. So let's talk about treatment. So one thing that I found that I think is really important to mention is that always check to make sure that you do not have a worm in your eye before you start treating, because apparently if you do have a tapeworm in your eye and you start treating, it can cause lots of horrible adverse effects. I don't know if it totally wrecks your vision in that eye, I'm not sure, but it can cause a lot of damage. And I think it has a lot to do with the immune response. So it's almost like when the parasites are in a sac and they're living, your immune system almost ignores it. And it's almost like, I heard one researcher say, it's almost like a symbiotic relationship. But as soon as the parasite dies, that's where we can get more, or maybe the sac starts to leak or break apart. that's where we can get more symptoms. And again, before I forget, this is so important that animal studies have shown that when animals have this neurocysticercosis, so they have these sacs of the larval cysts in their central nervous system, they have a demyelinating disease. So these sacs in the central nervous system of animals cause a demyelinating disease, like MS and like probably other conditions, different neurological conditions. So people keep asking me, like, so is it, you think that just the immune system has just adapted to attack itself with multiple sclerosis? I'm like, I absolutely don't believe that's the case. I've seen with Dr. Alan McDonald's research, like he really needs to win an award, and maybe somehow we can figure that out. So he has found Lyme spirochetes in the myelin of, I think it was Alzheimer's patients. So the Lyme spirochete can infect the myelin. So then, of course, the immune system is going to attack it. And these little filarial worms, the roundworms, which is another study where he found in every MS patient, he found these small worms. That is another place where those worms can directly cause damage and inflammation when your immune system is trying to deal with them. And then this is the third instance where when we have these immature tapeworm cysts from the larval cysts in the central nervous system that can cause, again, demyelination. So those are 3 examples of parasites that could cause our immune system to fight them, which causes inflammation, which can cause damage to all kinds of tissue, including our nerves. So I really believe that it is our immune system is intelligently designed, that once these parasites, and this is what we see in our students, if the parasites are treated effectively, people don't have any neurological symptoms. They still have the same immune system, but it's not attacking itself like they're trying to tell us that it's doing. And if you get rid of the parasites, and if it's the immune system that's the problem, that wouldn't be the case. The immune system would continue to attack itself, and it doesn't do that. So the immune system is overwhelmed with a parasitic infestation. We need to support it. We need to treat these parasites. So let's talk about treatment. So again, just make sure you have an eye exam and you don't have any small developing tapeworms in your eyes. But there is a distinction between when the cysts are in the brain or when they are in the areas surrounding the brain where there is spinal fluid. And there's different different things to consider with treatment in those areas. So if the cysts are present in the brain area, and if it's just a small number of cysts, then it usually is dealt with quite well with just using parasite drugs. But if they're kind of estimating that if there's more than 50 cysts in the brain, and also there's cysts in the areas where the spinal fluid would be around the brain area, the central nervous system area, then it is going to be much more challenging to treat, and the prognosis is not as good. So the choice would be, and probably most people would do really well with using pharmaceutical parasite medication to treat these, to kill the larval cysts. So they started off with albendazole, but it doesn't always kill the cysts well enough by itself. And so I've seen studies where they found that a combination of albendazole and praziquantel, and using high enough doses, and this has to be monitored with your doctor, and using it for a long enough period of time, that seems to treat the cysts. But if it's somebody who has a history of seizures, for someone who has epilepsy, then they really need to be monitored by their doctor to make sure that when you're treating these larval cysts, that you don't get such a strong immune reaction that could cause a really bad seizure and could potentially even be fatal. So that would be a really strong immune reaction to the cysts dying in the body. So then the immune system is not just putting up with it, then it really starts to attack and there's more war going on. So in that kind of a case, if somebody has epilepsy, then doctors will very often make sure that their patient has their seizure medication. And also, they will often prescribe a steroid that will enter the central nervous system. So dexamethasone is one example. And so that helps to dampen the immune response when the parasite is being killed. So again, the albendazole, praziquantel, in the little limited research that I've done, looks like it's a much more effective combination than just to use albendazole by itself. And so if somebody's been treated like for a long enough period of time using albendazole and praziquantel, then even if they've had epilepsy, then very often they don't need their anti-seizure medication anymore. So the CDC general principles for treatment is that parasite drug therapy, it's helpful in patients that have symptoms of the neurocysticercosis. I gave you that whole list of symptoms. And they have several cysts in their central nervous system that are alive. So some of them can be living and some of them can die eventually. And the parasite drug treatments will not benefit people that, let's say, don't have any live larval cysts in their central nervous system. And they recommend giving the steroids just to make sure alongside while people are treating, especially when you're treating pretty aggressively, to make sure that people don't have a very strong immune reaction that could be detrimental. Anti-seizure medication is given to manage the NCC in people that have epilepsy while they're treating. And then for some people, you can actually go onto YouTube and you can actually see certain doctors that are operating and taking these sacs out of, and I think that the ones that I've seen, it's where the sacs are more in the spinal fluid that surrounds the brain, because they're able to just pull them out. And they're just like, they have to be very careful. They use like little tweezers and they're kind of pulling them out, and it's just so disgusting. But you can actually watch them taking them out. Like years ago, I could only find videos with veterinarians taking out these little bladder sacs out of animals, but now you can actually see surgeons removing them from people's brain, and it's dramatic when they are removed. And they have to be really careful that they don't rupture the sac, because if they do, almost sounds like cancer, right? When they're removing the tumors, they have to make sure that they don't, break open the tumor and then you have metastasizing of cancer into different areas. And the same thing with the larval cysts. And then that parasite drugs are anti-cancer drugs. And it's like, that's another topic for another day. But it's really, really fascinating. And so treatment with both the parasite medication and steroids are usually required. For some people, they might need some shunting. Ventricular shunting might be necessary. But again, even people that have epilepsy, if these parasites are treated well, they don't need to use the anti-seizure medication in the future, to be determined with them and their doctor. But it's so cool. All right, so I think that is all that I wanted to share for right now. So the bottom line with this, and I'll go to your questions, is that MS is an infectious disease, and there are multiple parasites involved. I've shared that there's over 100 years of research showing that Lyme spirochetes are involved with MS. There's over 100 years of research showing that malaria babesia type protist is involved with MS and causes a lot of different neurological symptoms of MS. And then Dr. Alan McDonald has found Borrelia in the spinal fluid of MS patients. So that's the spirochete that causes MS. So that confirmed all those studies. And then he's also found the roundworms, the small filarial roundworms and so they're not in cysts, they're just roundworms, and they just flutter around and they cause lots of damage in the central nervous system. And then he more recently has discovered these tapeworm larval cysts in the spinal fluid of every MS subject that he looked at. And so that is really huge. So again, all these infections should be treated if we test well for the treatments for them. But just keep in mind that the bigger the parasite, the more damage they cause in our central nervous system, for sure, right? Because the bigger they are, the more our immune system has to try to fight it to deal with it. So yes, we need to treat Lyme, but if the small roundworms keep infecting us with Lyme, we need to treat the worms first. And if we have these tapeworm larval cysts, we need to treat them. The biggest culprits first, absolutely, but we have to do it in a safe manner. So what I'm going to do again is I'm going to put all of this information together on our blog post so that you'll have this. You can just share it with different doctors, with neurologists. If you know of any neurologists or any doctors that are really excited about this research and are really interested in trying to bring this out, and like what I would love to know, and maybe we can do studies, is like how many people that have MS like are testing positive, or like with the serology test and with the MRI scans are showing that they could potentially have the tapeworm cyst. Like, is it, so Dr. Alan McDonald performed one study, but can we duplicate that? Can we see if we can get the same results as him? That's really powerful. And that it's hard because we don't have access to spinal fluid, but some of you are having spinal taps done. And if we could talk doctors into, looking at the spinal fluid a little bit more carefully. And that's the one really awful thing that I'm going to leave you with, and I'll answer a couple of questions, is that in Dr. Alan McDonald's paper, he was talking about how the panel that is involved in putting together the McDonald criteria, which decides how we diagnose and how we treat multiple sclerosis. So that panel of people, they have said, don't look at the spinal fluid for parasites, for infection, because there's nothing there. It's of no value. Don't bother looking there. And I would say, like, really? Like, why? Why would you say that when we don't know what causes MS? We know the immune system is fighting something. We know that the immune system fights infection. We know that parasites cause lesions in the central nervous system. We know that the bands, the antibody bands that they're looking at with our spinal fluid for the spinal tap, again, that's our immune system fighting some type of infection. Why are we not looking at infection? Why are we only looking at like which medications might possibly change lesions? And they're not very good at it, are they? Because if they were, we would all be cured, and they're not. So why are we using these immunosuppressive drugs? Why are we assuming that our immune system is just attacking our own tissue for no reason? Why are we not allowed to look at the spinal fluid? And why is that not encouraged by the governing body that decides how MS is diagnosed and how drugs are approved, etc.? Well, look at the McDonald criteria, and I'll have that in my blog post. Look at the last page where they're declaring the interests, and you'll see a full page of very small print of, I'm sure, every pharmaceutical company that produces a treatment for MS. They are funding, they are paying for grants, they're offering grants, they're paying personal expenses, they're paying travel expenses. Is that not a conflict of interest? I'm just saying. That to me sounds like a really big conflict of interest. If I have a product that I can make millions of dollars on, and I am paying the regulatory body that decides if and how my product is going to be used, and I'm not influencing that in some way, I don't know. To me, that seems really, really fishy. And then why would that group say, no, there's no value in looking for parasites. There's no value in looking for infections in the spinal fluid. We're not going to do that. It's time for this to stop, in my opinion. It's really time. And I didn't know that until I read that paper, like from Dr. Alan McDonald, and I read the McDonald criteria, and I saw all of the interests that are involved in putting that criteria together. It's like, no wonder we don't have a cure for MS. No wonder we don't have a cure. Could it be so simple that it's just infections that are causing all of our symptoms? Yes, it could be. It is. It is nutritional deficiencies. It can be toxicity. And it can be parasites, and the parasites cause the most toxins in our body. Yes, we have to be aware of environmental toxins. Yes, absolutely. But if you have a tapeworm infection in your body, they produce, or different infections, they produce so many different types of poisons that affect you in so many different ways, directly and indirectly. I'm just going to go to your questions here. Hello. Awesome. You're ready to start pretty soon. I'm so excited to support you. Don't know who you are, but hi, Natalia. Hi, Dottie. Let's see. I've treated parasites in so many different ways. I've been told I have a tapeworm, I have neural symptoms still, and I have not watched you closely enough to know your treatment methods, and so you're listing. That's awesome. So we have not found that herb. So there's diatomaceous earth, there's mimosa pudica, there's different types of antimicrobial herbs. We would love to just use herbs, but they're not effective enough. They're not going to be strong enough to cross the blood-brain barrier. They're not going to be strong enough even in the gut to treat the larger worms. Like, it's shocking when we use the parasite drugs. We can use the herbs in combination. We're also using an oxidizing agent that I cannot talk about here, but I do have a great video on Rumble using oxygen therapies to treat parasites. Again, that's not going to be a cure by itself, but using all three together, it's so much more effective. Hello, Frankie. You have over 60 lesions in your brain. Please don't feel hopeless, honestly. Like, your body is a miracle. So this is, this is the CDC saying, if it's over 50 lesions, then it's, much more difficult. But we don't just rely on popping a pill. We use the Live Disease-Free diet, so we greatly reduce the food to those parasites. We start feeling a lot better. We start to support the body. This is the Live Disease-Free plan. We support the body in various ways, so we're feeling a lot better before we start treating. And then when we're treating, we're not just relying on only, like, if you have tapeworm, and I don't know if you do, but if you do, then we're not just relying only on just the albendazole and praziquantel or whatever you test well for. It is really a combination of different treatments, plus using oxygen therapies, plus using herbs. And we've had students that have had MS for, like, one of our students, like, for 30 years. She's just in the program right now. And just with getting ready to treat, like, her diplopia, where your eyes are wandering all over, her vision is focused. She can actually look at people, and she just, like, lays in bed and just, like, looking all over. It's like, wow, I can see again. So that's the power of the Live Disease-Free diet. And I do have the guidelines. If you just do a Google search of Live Disease-Free diet guidelines, you'll find them. You can also go to our blog post and you'll find them there also. Your dog had a tapeworm. So yes, I'm sure we can get tapeworm eggs from our dogs. And that is a different species than the pork. There's beef tapeworm, there's pork tapeworm, there's fish tapeworm, there's dog tapeworm. There's many different types of tapeworms. As far as I know, they're different species. And they all do the same thing. They have they have an adult form, and they also have a cyst form. And this is really important. When I was a child, I was underweight, I was skinny. Every time we would have any kind of special treats, I would have stomach aches. I'd be laying on the floor in pain. I had bowel movements once a week. I had so many symptoms of parasites, and I'm sure, and for me, since I've been treating, I've seen that I have roundworms, I've had past tapeworms, and I believe intestinal flukes. And we haven't even talked about intestinal flukes, but they can cause a lot of symptoms too. So if I would have been treated as a child when I had all those stomach aches, I would not have gotten MS today. Or, 35 years ago. I would not have gotten MS 35 years ago at the age of 28. That is why it is so important that we treat parasites when we have the symptoms of parasites. When we treat them early, we don't get the cysts forming in our organs and in the central nervous system. It's just like like an ounce of prevention is worth a pound of cure. So that is why we have to have change coming. We have to equip our practitioners so that they know about this. And then they're putting pressure that we're going to do healthcare differently and we are going to treat the cause. And then if we're treating these parasites early, we can make sure that our loved ones behind us, our children, our grandchildren, never end up in the same situation that we ended up. And if you're someone like Frankie who has 60, I think it was 60 lesions, there still is hope for you. Like, I'm a hopeless optimist. I honestly believe that if you support the body, we've seen like one of my students, or I'd say more than one, had their hand clenched like a claw for years. Like for one of them was for 40 years. And by just following the diet and starting to introduce like the oxygen therapy, her hand opened up. And as she started treating, she could do physio and she was able to start working her hand. And it might not be perfect, but she can shave her armpits. She can do all kinds of things with her hands now. And we've had so many students, like one was a speed writer and she couldn't write anymore. And now she's back to writing again. So there, there is so much that is in the inflammation stage that is not permanent damage to the nerve. That's a really big nugget I'm giving you. That is why people are having so much more symptom improvement than they thought possible. We thought if you're in a wheelchair, you're done. You're in a wheelchair, but that's not always the case. We see people coming out, and the better that we get at treating, and maybe there is the odd person that does have to have surgery. But my mom had brain surgery. She had a non-malignant brain tumor, and this was years ago, and she's just rocking it. She's in her 80s and she's doing fine. So for some of us, if we had to do that, we can do that. It's not fun, but it sure beats living with neurological diseases. Probably for most of us, we are able to treat the cysts with just the treatments, with the drug treatments. So, and it really depends on how big the cysts are. Like if you look online and you watch those doctors operating, some of those cysts are really big. Hello, Susan. Very interesting. Yes, Christina. Um, yes, I need to also, but when I have asked to be tested in California, I was told that we don't have them in California. I know. This is why we have to look for doctors. And what I would do is I would look for a doctor. You know, we had this COVID, I didn't even want to say the name. We've had this virus crisis for the past 3 years. So doctors that were doing early treatment for COVID, I would seek them out because they are forward-thinking doctors. They are doctors that really are open and they want to help their patients. So I would look towards them. You might find somebody that is willing to help. Did he? I don't think so. Did he? I hope not. I haven't heard anything. I will check that out. I really hope that he didn't. Can we catch them from pets? Yes, you can. And you can catch them from other humans too. It has more to do with if you get the eggs on your hands, you have to ingest them. They're not going to crawl up you. You have to ingest the eggs. So, Anthony, you have tinnitus, weakness, spasticity, vision problems. Yes. Definitely parasites. I have had someone do applied kinesiology and told me how long the tapeworm was. That's amazing. Can they do the MRI without contrast dye? I'm not sure, Susan. I personally would not do the contrast dye for sure. I can't remember if the contrast dye is to see the activity level of the lesions. I agree. Rheumatoid arthritis is another bugs of some kind. Absolutely. So we have students, it doesn't matter what the condition is. They all follow the same plan. Stop feeding the infections. Their favorite food is carbohydrates. So we still eat carbs, but we're decreasing them significantly. So decrease the food to them, support the body, and then from there, treat them. And you should be feeling a lot better before you treat them. And then when we treat them, we definitely get energy tested to see which treatments are better. So we're not just automatically, every MS student is not like, oh, we're going to treat tapeworms. It's like, do you have symptoms? What's your health history like? Have you tested well for treatments that treat roundworms, like even niclosamide? So if you, I should say tapeworms. So things like if you test well for praziquantel and niclosamide and albendazole, you could easily have tapeworms. You could also have flukes with respect to praziquantel because that's another type of flatworm that praziquantel will treat, but you could have both too, right? For myself, I know I had both. And you think, how is that possible? I know, how is that possible? The test for MS is the spinal tap to test the myelin sheath protein in the spinal fluid. Is that correct? The spinal tap, if you look, they're looking at bands of antibodies. All right. So that's what they're looking at. And antibodies are your immune system produces antibodies in response to infection or some kind of foreign invader. An eye exam is required. You know, I would personally, like after I heard that, I would, especially if somebody's really, really sick and they've had a lot of vision problems, I would definitely make sure that they have had an eye exam to make sure they don't have the worms in the central nervous. And I'll put that in the blog post too, in the eye. So you looked into praziquantel, you've only taken it one time, it doesn't seem right. You have to take the right amount, and that's where, like, I am not saying any of you should self-treat yourself. I personally would never do that. I would never do that. Like, you need to work with someone. We help students because our students, like, if you even find a doctor, they usually don't know how to treat parasites. They haven't worked with a parasite drug. So if you need help, if you can't find help, that you need support in building a plan to treat, that's what we help people do in the Live Disease Free plan. But you're right. And again, don't just try to get access to a treatment if you don't use the right amount. You can actually make these parasites resistant, and then that drug isn't going to work for you in the future, or you could hurt yourself. Is it normal for walking and balance to get worse when first treating? No, you should not be getting worse. And that's what we do in the plan, is that we're supporting the body. You should be feeling a lot better. And then when you're treating, you're introducing things slowly, one at a time. And no, you should just be feeling better. So your balance is not good. I don't know who you are and how you've been treating, but if you have done the proper prep phase, like we do in the Live Disease Free plan, and you're using the right treatments, that's the key, is both have to happen. You have to use the right treatments, and you have to, if you're eating a lot of carbs, the parasite drugs don't work very well. That's what we've found. Susan, you have an older MRI. Could these larval cysts have shown up? So the neurologist will say you have lesions in your central nervous system. They don't know what's causing the lesions, and they'll say they're not parasites, they're lesions. But they don't know that the scientific literature says that parasites show up as lesions in the central nervous system. That's just, and I've shared that, I think, in the blog post last week. There's studies you can see. And even with these larval cysts, they show up as lesions in the central nervous system. But our doctors haven't been taught that. They're told that we don't get parasites. We can only get parasites if we travel to an underdeveloped country. Couple more questions here. Is Lyme connected also? Yes. So I did have a bullseye rash, but I didn't have a positive test. But we never start treating Lyme first because you may have been bitten by a mosquito, a tick, but also the worms carry Borrelia. And if you do have the larger worms, then you'll keep getting reinfected. Like, treat the larger parasites first and then work down to the smaller ones. But it's very common that we do have the Lyme infections when we have a neurological disease, for sure, like MS. Anthony, how do you get the blog? I cannot wait to start to see it. So it will be for sure by Friday. Go to livediseasefree.com. You'll read my other blog posts, and there's videos. We have a really helpful blog post. And so that's where I put my notes and I put my video. So go there and just look at the last 2 weeks. So last week I shared Dr. Alan McDonald's study about finding the the tapeworm larva cysts in the spinal fluid of every MS subject he looked at. So that's one of them that I found. That's what I did last week and the week before. I can't remember if I talked about tapeworms in general. So go through those first. You'll get a lot of amazing information. And then this one will be up Friday. And you can go to our website. And if you want to watch my masterclass training anywhere, if you opt in where you share your name and your email, then you'll always know, because we always put out a newsletter on Fridays. And that way you are always notified when I have this information available. So Susan, your brain is lit up like a Christmas tree. I'm so sorry to hear that. It is just parasites for sure, and you can treat them. That's the only way to recover. We used to get pinworms as children. My brothers and sisters would get worm medicine from my mom, and I don't know what it was, but it worked. There's different things. Like I know for pinworms in Canada, Combantrin is over the counter, and in other countries it's mebendazole. But again, you have to use the right treatment for what you're dealing with, because if you use mebendazole and you have tapeworms, it's not really going to help. So you have to use the right treatment for the types of parasites that you have. Natalia, we can starve parasites with a new eating plan and get. So Natalia is in the program right now, and she's having a lot of symptom improvements already. She's getting ready to treat. And so happy to support you, Natalia. And Jacqueline, I'm having an MRI for my lower back. Okay, and parasites cause low back pain for sure. And I don't know if it's going to show up as a cyst, but yes, low back pain is notorious for a parasite symptom for sure. David, MRI is the tissue, CT is the bone. MRI, yes. No, CT scan is the bone. Yes, but apparently they're using the image, the CT for, they're able to pick up some aspect of the lesions or the cysts in CT scans also. And Shelley, are you aware of the treatment for MS that uses parasites? Yes, that's a really good question. So I really believe that they're trying to get us off track. Like, there is a study where they gave, and I can't remember which exact worm it was, but they gave some MS patients a specific worm, and I can't remember if it's a hookworm or it's a type of roundworm. And some of these parasites, what they can do is they can produce things that will kind of suppress your immune system so that your immune system won't really fight them. And so then they call that immune modulation. It's like, oh, your immune system isn't fighting as hard because the worm is suppressing it. So that must be a good thing. But if you look at those studies, you can see that those participants are after a while, they're like, can you get these tapeworms out of me? Or not tapeworms, these worms out of me, because they have terrible gut health from those worms. And then, so that's one thing, is that I would never, ever let somebody give me a worm for sure. We've got to use our common sense. Does that even make any sense? And then secondly, it's just well established with the CDC, with the scientific literature, that tapeworms cause disease in animals, they cause disease in humans, that you want to treat them if you have them. It's just they don't think that we have that many of them. Filarial worms in the central nervous system, same thing. If you have filarial worms in the central nervous system, in science, it's known that it's very destructive in animals and in humans. It causes, if they get in the eyes, it causes river blindness. And if it gets in the lymphatic system, it causes elephantitis. If they get in the central nervous system in animals, they have all the symptoms of MS. So when somebody just shoots off a statement like that, it's like, you don't even know what you're talking about. You're just saying such a general statement, and it can be really harmful because you don't know what you're talking about, and you're just stating something, and you're getting people confused when you haven't done the background research, you don't even know. So that is the frustrating thing about that. And there's some people that are really high up in the integrative field in MS that really believe that research, and it's just really holding us back from getting a cure for sure. Last question. Do genetics have an effect on our immune system? And if so, do parasites pass from dad to kids to generate an immune system disease? So we can definitely pass parasites from parents to kids. Again, it would be more, it's through your mouth, right? As far as I know, it's just through your mouth. So it's if you're not using good enough hygiene, but it could be even like, this is where in time we're going to see like how many different types of species could be affecting us. So like if you have animals, different types of animals that, like I grew up on a farm and I was helping my dad out in the pig barn. So I could have easily picked up the pork worm because we were cleaning out the pens. Like, talk about disgusting, but it was fun. It was exciting. It was being with your dad, and we had lots of pigs. And so I was out in the pig barn, but we also had dogs and cats and chickens and turkeys and bunnies and horses and cattle. So I was on a lot of antibiotics and I was exposed. I was probably, as a kid, you're not washing your hands all the time. So you pet the kitties that have parasites or the dogs, and, maybe you're out with your dad and you don't wash your hands well enough. So it's so easy to infect ourselves. So we don't have to be paranoid. We don't have to just be like washing our hands every second, but we have to be smart. We have to start paying attention to symptoms. So when we start to have, like myself, a lot of gut pain, constipation, really hard time gaining weight. Then I had appendicitis issues. And then I've got all these symptoms of my red blood cells being off, like a vitamin B12 deficiency, which I didn't know until I researched it more. But my doctor was like, oh, no, that's just you. You're just a little different. And it's like, well, no, like that is not good, because if your red blood cells are affected, if they're bigger than normal and you don't have as many, you don't process oxygen as well, right? And that's another sign of different types of worms, is a B12 deficiency. And being anemic, I was anemic a lot. So and then I tested really well for praziquantel, like whoa, off the charts for praziquantel and for niclosamide and for albendazole. And so when you put all these pieces together, and then when I'm passing the worms and it looks like a tapeworm, it's not round, it looks more segmented. It's like, you have all this evidence then. And then Dr. Alan McDonald found all of the tapeworms in the spinal fluid of the cysts of every MS patient. Then, I probably, and I haven't been treating the cysts, and I have used the parasite drugs, so I'm not sure if I have treated them well enough or not, but that is something that I'm going to be looking into more also. You're very, very welcome. So with that, if you are new to all of this, I've got so many videos. We've got the blog posts. Make sure to start to learn. There's a playlist on YouTube, Live Disease Free. You can learn about the infections. You can start to change your diet. You can start to feel so much better just with diet alone. And then if you need support, if you need help with building a plan to treat these parasites to recover, then make sure to watch my masterclass training. And there you'll learn the steps we take to recover. You'll hear some amazing success stories from our students. And then you'll learn how we can support you in the Live Disease-Free plan. If that's what you would like, you can, if you really want to work with me, you can book a time to chat with me, and I can go over your health history and really just make sure it's a good fit for you. And if you find this information helpful, if you appreciate all the digging and research that I'm doing, please like and share and subscribe. Help us get the word out. Share this information with doctors, with whoever will listen, because we need this to be part of our standard of care. We need our doctors to be doing this. We need our doctors to treat early so that we never end up in this position again. So with that, I'll be back next week, same time, same place. Take care. Bye-bye for now.